My name is Cindy Ciabotte, and I'm the Director of Center Registration for Northeast Health Patient Care Division, which includes Samaritan Hospital and Albany Memorial Hospital. We've had success integrating the consent process and the HIXNY patient choice within our current processes. That is the secret of how we have achieved I believe, a very excellent positive response from patients. For instance, when we do the computer entry, it is just one of the questions that we ask, just like we ask other questions within the computer entry. When we have the HIXNY consent signed, it's another consent that patients sign in the routine of signing paperwork at the end of their registration. So we've integrated it. That process, though, is a small piece of the HIXNY process. First, you have to share the vision of HIXNY, the impact for something to have meaning to staff. They have to know that what they're entering in the computer has impact to the patient. We're here to help patients. We're here to make the medical decision making better. So that one little field out of 100 questions in a registration allows a clinician, a pharmacist, a nurse, or an ER physician to review data, which in some instances could be life-saving. So the HIXNY regional staff prepares training materials for you. The staff will come in and do the training for you, get you started. I chose to do my own training because I had a good understanding of the background, so I was successful with that. The other way that the HIXNY staff supports us is if there are questions along the way that patients have to a level of detail that we don't know. So staff in their initial training were trained to a certain level of detail and they can answer most questions from patients. The fact sheet allows staff to answer most questions from patients. And then I'm a local resource for my own staff. But if there's something we can't figure out or have questions about or hasn't come up yet, regional staff at the HIXNY office has been very helpful. They're in communication all the time. Patients are ahead of us on this. It's my belief that the patients already expect that systems are communicating with each other. They expect in an electronic age that if my doctor's office sends me to the emergency room in the hospital, that they will have given me information about why I'm coming and what I need. So we have learned the lesson and we have achieved a 97% positive consent rate for our patients. And we have done that because we've let the patients lead that. The patients already think we're doing it. And we are exchanging information. Every day we call pharmacies to get medication histories, and we call doctor's offices to get information, and they call us. So we're already exchanging information. HIXNY's benefit is that we can exchange it faster, and we can exchange it more thoroughly outside of the barriers of each facility and each hospital and each healthcare system. So it really is a patient-centered system, and that's really what we're all about.